Hey, hey, hey. Good morning. It's top of the morning. You're back with your girl, Miss Charlie.
You know what it is? Man, like Isaac is here this morning, sipping on my tea.
That's what I was about to say. Sipping on your tea, slipping on your cue there, mate.
Tea, just tea, just tea.
I was slipping on your cue. I was very like, good morning. It's Miss Charlie. And
You don't know. Morning, everyone. What's going on? What is this lockdown day number what?
girl, ain't nobody counting these days no more.
Listen, we gotta count it down. Christmas is on the way.
Oh, actually, don't remind me, to be honest. To be fair, I'm not buying any more presents. I bought for the kids this year. Sorry,
Yeah.
adult. Y'all too grown now.
Yeah. I said they bought no kids, nothing. I need to get a move on. It's that real. You get
For
me?
real.
They didn't cut my hair for them people there. Find me a barber. I'm actually going to hashtag find me a barber.
I'm so done with you. You know what we need to do? Have you seen how they spray on this like hair dye and give people shape ups?
Oh, for real?
Or have you seen the man's weave?
I've seen the man's weave. I will not be participating in the man's weave. But
I
shout
think we should do it one day. We should do it one day for the podcast.
not me. We have to find somebody else that's prepared to do that. But
Come on, man. Let us record you getting it done.
no, man. That's not
For the
happening.
bands.
No.
For the bands.
No.
All right.
Hey, I'm
All right.
loving the hair though. I'm loving the hair.
Thank you. I was
Loving it.
do I tie it up real quick or do I just let
Oh,
the maid?
man, leave that El Natural. This is what I love to see. And I know there's my man them out there that know this is what we love to see. Natural.
Fair enough.
None of this next thing. I'm not even gonna cuss that thing, but none of that next thing. That straight relaxing corporate thing. Man wants the Nubian thing. That's the thing I'm after. The Nubian thing.
Right. So speaking of natural and fake and propaganda, as we love that word on this show, talk to me. Introduce our next topic.
Right. So guys, I'm gonna introduce this next topic. I'm gonna share the screen. And I want you guys to decide what you guys think, really. Obviously it's about the corona and the vaccine. I'm not really happy about this, but let me know what you guys think. Man, they're still learning how to use this Zoom thing, so just bear with, man. Why ain't the screen sharing? Ah, there we go. 1 second. There we are. Right. So people, instead of taking my word for it or taking Charlie's word for it, this is what it is. Pharmaceutical company Pfizer suggests that hopes rise for the end of the pandemic. And they say the vaccine is 90% effective. Now, I've heard Boris Johnson say that the vaccine he's not totally responsible for the side effects. So that's a bit.
Yes, so they've taken away liability of the company Pfizer who make the vaccine. They've taken away the liability from the NHS who'll be delivering. Actually, they've also, like I was saying in the last video, they've given now the power to local authority to immunize people, to vaccinate people, should I say. And nobody will be liable for your side effects if you have side effects. Also, this vaccine is coming out unlicensed.
Right.
And they've given the okay for us to take an unlicensed vaccine that nobody can be liable for.
Crazy.
Absolutely crazy.
So I wanted to just read the coupled lines and then we can go into what we want to discuss. So hopes are soaring that a COVID vaccine is within reach following news that an interim analysis has shown that Pfizer BioNTech's candidate was 90% effective in protecting people from transmission of the virus in in global trials. I don't believe that. The vaccine performed much better than most experts had hoped for, according to the company's analysis, and brings into view a potential end to the pandemic that has killed more than 1 million people, battered economies, and upended daily life worldwide. Guys, if you want to know more about this particular topic, head over to the Guardian's website and do more research for yourself.
Mm-hmm. Also, if you wanna fact check what I've been saying as well, like go on the government website and look this stuff up for yourself.
Right. So now they're saying that it's 90% like good to go and ready to help people. I don't believe that if they're not ready to take responsibility for the vaccine, if it affects people. So what are they talking about?
Boy, personally, I won't be getting no vaccine. I won't be getting no vaccine unless it becomes mandatory and they hold me down and inject me with the vaccine. I think I'll wait a good year or so before I see what happens. If you think about it, we've been dealing with COVID now for over a year.
Mm.
It doesn't even feel like it's been that long. So I can wait a little while longer. Also, from them being falsifying all of the like death certificates and stuff, like how do you even know that many people have actually died of COVID?
That's what I'm saying. We don't actually know. A lot of people have passed and they've just pretended that, you know, they've died because of COVID. I mean, one of the things that really interests me with this is when they're talking about the candidate was 90% effective in protecting people from transmission of the virus in global trials. Now, who have they trialed globally? Have these trials even been sanctioned? You know, how long have they taken before they've decided that there are no side effects? Because it comes like they're putting it in somebody and then they're doing a trial and then a week later they're saying, yeah, it's safe. But we all know medicine doesn't work like that.
No.
So
and how many, also for me as well, like you're not every two people are the same. So how many, you know, people have you tried this on with different health ailments, with different cultural backgrounds, with different, you know, like structures? I don't know. I don't know how many half Irish, half Nigerian ladies they've been doing it on.
exactly.
So I don't know how safe I'm going to be, especially when no one ain't going to take no liability, and it's not even it's not even licensed. Get out of here, man. Get out of here, man. I'm not about it.
And why are these companies like Pfizer, for example, just being allowed to, you know, put it out there and do all this testing and why are they not being held responsible? You know, I can't make, obviously we get their corporate company, you know, let's take the conspiracy theories and let's take away the reality that they are a top company, they've got money, they've got this, they've got that. But why isn't, you know, I'm not sure who the governing body is for pharmaceutical companies, right? And I probably need to do some more research on that myself. But why are those individuals not telling these pharmaceutical companies, like, whoa, pause, you can't do this. You know, this is not allowed. And you're talking
So
about
what I read was on the UK government site was that because it's a worldwide pandemic and they don't think we have enough time to wait for these trials to go through long periods of testing. So they want to speed it up, take away all liability just in case. And yeah, try it out on everyone. I'm not for it. I'm just gonna continue to say that. I'm not for it.
I'm really frustrated with this COVID vaccine situation because, again, my condolences to every single person that has lost somebody during COVID. Please do not take my words as being insensitive, because I understand it's a sensitive topic when you've lost someone in your family down to this particular pandemic.
Right.
But I'm also sure that those people that have lost family members, maybe not agree with me, but just reason with me for a second. The majority of the world are not dropping down like flies. Yeah. So why can't we take time before we just bring out this vaccine, because I feel like this vaccine is going to make us all drop down like flies. Because a vaccine is they essentially put the thing in you at a small dose for then your body to fight it.
Yeah.
I don't
So
want COVID because
white blood cells against it.
the COVID that initially came that was airborne clearly ain't really on much because it's not taking that much people. But this COVID that they're injecting into me, I don't even know where that COVID is. What is that? Is that COVID-20? Are they giving man COVID-20 and then telling me it's COVID? No, you got to be serious, yeah? The first wave of COVID, right, was supposedly airborne, like a flu, like a cough, or something like that, right? I still don't even know. I still don't even know how to explain COVID. Do you know what I mean? But I know that it's airborne. You know, it's mouth and nose. It's like a flu, right?
Yeah, it is. It's essentially it is a kind of
hybrid flu.
Yeah, developed flu. Yeah.
So if that's a hybrid flu, yeah, this one that you've made in the laboratory, yeah, this is a triple hybrid. This is a quadruple brid.
I don't know the science. I don't know if they've made it or if they've taken a sample of it. I don't know what they've done.
But they've done more than whatever it was. They've done more.
I'm just not for it. I'm just not for it. I'm not going to bash anybody who wants to take it. Take it. Do your thing. Just be aware. Just be really aware of, what is actually going on right now. And be aware of your safety, because like for me, I have private healthcare. I live in the UK, we have the NHS, but I also have private healthcare, and nobody wants to touch COVID. Not private healthcare that you're paying for monthly, not private healthcare that you're paying grants for. Nobody wants to touch this situation. Nobody. So if nobody's taking liability, what's going to happen when we have a mass of people in A&Es because they've actually taken this vaccine? And as far as I'm concerned, I just don't trust it. I don't trust it. I don't trust them. I don't trust the government. I'm not anti-government in any way, shape or form. I just don't trust them. Like, they've not proved to me that they are for me as a people. They're not for me as in fact, that's a whole nother conversation to unpack on another day. But I'm just not for it. No way. No.
I think this is probably a lot close to home. So they're doing open testings in Liverpool. I know you've got your roots are from Liverpool.
Yeah.
What's it like up there? What's the general consensus? Are people happy? Are the news lying to me? Is everybody, or are people really all standing up in the line to take this vaccine?
Do you know what? I actually don't know. That's a good question. Like, we should have asked me that before. I could have called my cousin and be like, "What's going on?" But I mean, my cousin had COVID like before we did the first lockdown. She was tested positive for COVID. In fact, no, she didn't test positive for COVID. They told her she has all the signs and symptoms, so therefore she has COVID. But everything, like all of her signs and symptoms, were just like a really bad flu. So I mean, apparently it's been really rife over there. It's been really bad, and everybody's been getting it left, right, and center. But it's really difficult, because how do you differentiate who has the normal natural flu and is really suffering with that, and who has COVID, when actually maybe they're not getting pneumonia straight away, which you can get pneumonia from the normal flu, which will then give you breathing issues. So, I don't know. And I hope not every fool is, in fact, I'm not even going to call them fool. I just hope my family ain't standing up there waiting for this vaccine, thinking it's going to save their lives, because it's not been through the normal trials. We don't actually know. Once again, we're left in this unprecedented time, and we don't know what's going on. And I mean, that's all I keep hearing people say is, we don't know. We don't know what's going on. So,
guys, let us know what you think. It's important to let us know what you think. Like, comment, share, and subscribe.
And all that good stuff.
And tell COVID to tell Auntie COVID to tell Granddad COVID to subscribe to.
I'm
Because I'd
sorry.
love to hear what they have to say.
I'm done with you.
And guys, research Pfizer.
Yes, it's got some weird spelling though. How do you spell it?
Right.
P
Put him in a spot still.
H.
PFIZER.
There we go. All right, guys. Let us know what you think, and we'll be back. Peace.
Peace.